now trying to move over to the panel discussion, where I'm going to be joined by three phenomenal and amazing young people from the key populations. So I'm going to be joined by Tung. Tung is from Vietnam. Then there's also going to be Thandiwe. I prefer to call her Thandi. She is from Zimbabwe. Then there's also Irene. Irene is from Indonesia. So guys, can I see your faces? Colleagues, friends, can I see your faces? Then we can get the ball rolling. Fantastic. I see you trying to wave your hands. So as we follow up on what was said by Melusi before, I'd really want you maybe to share with us some of the experiences you might have encountered, maybe to really feel like, do these things exist in your countries from your personal experiences? Is it something that you can also relate to as young key populations? So I'll start with Tung, then move on to Irene, and lastly, Thandiwe.
Thank you, Tina Shay, for the questions. Hi, everyone. My name is Tung, and I'm from Vietnam. I'm working at the Lighthouse Social Enterprise and Young Key Population Lead Organization. And thank you very much for having me in this panels. I'm very much looking forward to our discussions about access to services of young key population. Regarding the questions, I think Melusi have very well stated about some existing barrier faced by the young key population over the world. And I think it's quite similar in Vietnam. In 2020, we conducted a study with young key populations and within the Young, Wild and Free projects. And we also identified some key factors that hinder community to access the services. And we also found that the young key population have very poor access to the needed services. I think the first factor is a lack of adequate information about the sexual health and HIV and AIDS, and in both information and also information related to the services. Self-stigma among the young key population is a very large barrier for them, and also stigma in healthcare setting as well. And we also realize that there are some services that very essential for the community are not exist, such as like mental health care, harm reductions, legal services, hormones, and also gender-based violence support. And like the Melusi also mentions about the consent, law of consent, and some people who below 16 years old, they still have to get the parental consent, so that's why they cannot access to the services that they need. And last but not least, I think the community-led services has proof that they are very effective to attract community to access services, but it's not very well invested and are not really be engaged and include into the national services by the government. So I think to address that, we need to fill those gaps. Yeah.
Fantastic. Thank you so much for that, Tung. I move over to Irene. Your quick thoughts, reactions, feelings. We just want to hear them.
Okay, hi everyone. My name is Irene Audrey. I'm from Jakarta, Indonesia. Previously, I was program manager of young key population organization in Indonesia, namely Inti Muda Indonesia. Inti Muda Indonesia is the only young key population organization and in Indonesia that works in three work area: advocacy, networking, and capacity building, and works in 7 provinces in Indonesia. And Inti Muda Indonesia also brought me today to this activity to be able to meet you guys virtually. And in this today's session, I will tell you about myself, the community, and the situation of drug user and young female sex worker from my and community perspective. First, I identify myself as a young female drug user and a young female sex worker. I have an addiction to the substitution that is Suboxone. The use of Suboxone by injection is becoming a trend in Indonesia. Many young people in Indonesia, especially in Jakarta, use Suboxone and also mix drugs with antidepressant. Even though amphetamine is using by injection, with the trend being called Jordan in Jakarta. Supposedly, Suboxone and methadone were substitutes that were accessed by previous heroin user. And the increase in HIV rates, especially in the city of West Java, has increased due to user of injecting Suboxone, and it is also difficult to access a sterile needle in health services. Likewise, in Jakarta, I personally can only access in one health service out of dozens of health services in Jakarta, and the access is also far. So that is the one of the impact of the increase in HIV rate, especially in West Java. As a young woman who use drugs, I make sure that access to needle in health services in Indonesia, especially in Jakarta, is still difficult. Not only access to needle, access to substitution is also difficult. And in Jakarta, we have only 2 hospitals that can access Suboxone. That in contrast to methadone, which is available in several health services. The black market distribution of Suboxone also expanded in Jakarta due to the difficult for registration as a patient at that 2 hospital. The black market sale of Suboxone, which result in the trend of injecting drugs for young people who previously did not use heroin, being easy to obtain, although at a very expensive price. And youth-friendly services are still not running well, even though very few health services are friendly to young people. There is still discrimination in health services, which is makes me and makes my community is uncomfortable for YKP to access health services. For example, like stigma of women with tattoos, transgender woman, or feminine boy. And apart from my addiction, I also became a sex worker through an online application. And during the COVID-19 pandemic, which has not improved, many small and large company or workplace have bankrupt, and this has an impact on people who find it difficult to find a job to work, especially for YKP who do not have the requirement, the data to apply for a job such as school diploma. It is difficult to get a job. This is also felt by transgender women who find it difficult to find work because their identity as a transgender has not been widely recognized by companies or several small companies such as cafe, restaurant in Indonesia or Jakarta. So I and several other young female sex workers choose to provide our service as young female sex worker through an application that can be downloaded via iPhone and Android, which is well known in Indonesia. Apart from this application, there are still many sex workers who are still looking for money on the street, hanging out on this side of the road, and have a hotspot for every night that they working, and of course they have a very big risk if they are a cops patrol. The risk that I face, it as a young female sex worker, such as having my belongings stolen at the hotel, my phone, my money, and other risks such as sexual violence. I often experience BDSM requests without consent. In addition, there are some customers who insist on a high fun with drugs. Even though I'm a drug user, I don't have courage to use drugs with people or customer I just met. And yeah, sorry, maybe I only can share a few story with you guys about my experience as a female drug user and female sex worker. I hope this story will provide a follow-up plan to advocacy for young key population in Indonesia. Thank you so much for your time. Over to you, Tina. Thank you.
Thank you so much, Irene. Thank you so much. So we are now going to move over to Thandi. Then when Thandi is done, I will ask another one of the questions that I have. And Irene, maybe you can also start to respond to that, because I see more of a connection on what you said now and one of the questions that I have. Thandi, over to you. Talk to us.
Thank you so much, Tina, everyone. I'm Thandiwe and I'm from Zimbabwe. So in Zimbabwe, the LGBTQ organizations are not fully operational since they fear the locality. Sorry, can you hear me, guys?
I can hear you from my end.
Okay. So key populations are often difficult to reach for critical testing in Zimbabwe and treatment services. They face a higher risk of acquiring HIV, and they have a risk for higher transmission, and yet our access to services are limited. The rates of accessing safe, effective, and quality HIV services are extremely low. This is because there is a lot of stigma and discrimination, including gender-based violence, higher compared to the general population, and also significant barriers such as police brutality, societal discrimination, and insufficient community-based services prevent us from getting the care that we need. However, it's unfair to only talk about that, because there are some organizations that offer free services for SRHR services, right? I even got vaccinated for free at this LGBTQ organization. So, yeah.
Fantastic. Thank you so much, Thandi. So I think as young key populations, many times we also talk about quality youth-friendly services. And I just want to hear from you, like, to us, how do you think they should also look like? If you can describe one or two interventions that you would also like to see, that would be great. So I'll start with Irene, then I'll move on to Thandi, then lastly, Tung. Over to you, Irene.
Yeah, sorry.
Yes. So my question is, at many times we talk about having quality youth-friendly services as young key population, but to us, what do we look at? What should they look like? And if there are any one or two interventions that you can share with us, that can also be helpful.
Okay, in Indonesia, okay, let me think. There is like three years later. Sebelumnya apa? 3 years ago, we in Tim Muda Fokus Muda have program is called Lollipop. Lollipop is like youth-friendly services, and when the program is finished, the youth friend the youth friendly services is not is not friendly anymore. And in Indonesia, young people under 7 years old have not been able to access HIV testing without parent consent. And Inti Muda Indonesia also doing the advocacy through the Ministry of Health, and I hope it's going to good. I hope so, and yeah, that my answer.
Thank you so much, Irene. Tun, over to you.
We are lucky because we have the opportunity to implement some interventions to ensure the friendly environment for young key population to access the services. And from my points of view, I think unfriendly services for young key population or youth friendly services. Firstly, I think the service have to be accessible and available, both the services and it's related to information for young key population. And I think the second criteria that services are full, friendly with the community, and also to meet the need of community. Like I said before, there are several services that are not available for the community: harm reduction, gender-based violence, and mental health care. So it needs to be, accessible and available for the young key population to access. The third criteria, I think, the service environment should be friendly with the community in decoration. When the community they come on clinic, they have to see some community signs. It is clean and no labor image or message. With the very friendly, healthcare providers, and the service provider, not only the medical staff, but also receptionists, security officer, and also cleaner. They have to have the good understanding about the young key population, what is their need, what is their concern, and also act and behave friendly with the community. And the next point, I think, the health facility, they should also provide the confidential and convenient feedback mechanism for young key population, because sometimes a lot of young KP and my peers, they share that they cannot communicate with the doctors, or when they have some feedback to the health facility, but they don't know the mechanism to provide the feedback. And I think lastly, the health facilities, they should have the community engagement in design the services that they provide to the community, also engage them in terms of like support to provide the services to community itself. And I think one of my very favorite models and interventions that is community scorecard, that we inspire by Y+ within the Young Wild and Free project, and we have opportunity to scale up in Vietnam in combined with another model is called key population friendly facilities. And so within that project, the young key population themselves, they are empowered with the tools and also with the skill to work with the healthcare facilities and healthcare provider. Together, they build the relationship first. I think that is very important to work together with the health facility. And second, they have opportunity to, together with the health provider, to identify the gaps and issues faced by the health facility. And then they work together to make the change. And then after like a 6 month or 9 month, we do the post-assessment to record what have changed in the services, what was improved in terms of the friendliness and quality of the services. And I think we also have successful to advocate with the Ministry of Health to develop a national criteria for the friendly healthcare services for the key population. So that is very soon, I think we continue to advocate to apply it in the national scale in all health services in Vietnam. So I think that is not only fill the gaps in the health facility, but also we're trying to address the structural barrier in terms of law and policy. And hopefully very soon the Ministry of Health, they will apply and they have a mechanism to support the health services in Vietnam to practice friendly with the key population, especially young one. Thank you.
Amazing, amazing. Thank you so much. Thandi, any quick thoughts?
I think free SRHR services for young key populations, advocacy, information and education, and also communication. Also universal access to accurate sexual and reproductive health information. Also a range of safe and affordable contraceptive methods, and also sensitive counseling. Yeah, and also promotion of healthy sexual behaviors, and also referral services, providing health talks for young key populations.
Great. So maybe now we want to hear from you on one thing because of time. When we look at the structures, what do you think can be something that can make a huge change? Because we can't talk about high quality interventions without addressing the issues of structures. So I'll start with you, Tung, then I'll move on to Thandi, then lastly, Irene.
Yeah, I think I have talked a little bit about the structural change and structural barriers to make the change to help the health facility to be more friendly with the young key population. I think education is a fundamental foundation to help. I think the first to help the community to better access to the services. And I think if we also provide the education to the healthcare provider about the key population and people living with HIV, and also how to communicate with them, those will help the healthcare provider to act and to behave friendlier with the community. And I think we also should advocate to have the specific law and policy to avoid stigma and discrimination toward young key population. In Vietnam, we don't have that law. So it is very hard when we receive some like some people who report that they are facing with the stigma in the healthcare setting, but we don't have any mechanism to address or to report or to handle that case. And I think the next we should also develop the common criteria and code of conduct of friendly service provider and service facility, and it should be applied and scale up nationally in all health facility that serve young key population. And I think the community engagement in monitoring of the quality and friendliness of services is very extensive, and it should be scaled up and it should be applied in all setting of the health facilities. So yeah, so I think I have that point.
Fantastic. Thandi, any quick thoughts, reactions on the question?
I think addressing stigma and discrimination, and also community empowerment, and addressing violence, and maybe having clinics where they are only for young key populations, where they are not judged and they are accepted for who they really are.
Great, great. Irene?
Yeah, okay. I think we need programs and movement from national network, especially in Indonesia or in your country, that can help to advocate to health service or Ministry of Health. And the point is, we have to work together to make it happen. Yeah, thank you.
Great, great, amazing. So we heard all the stories that we shared, some of the challenges, some of the recommendations that were quite clear. So now maybe if we can end on a bit of a positive note to hear from you, colleagues, friends, on any youth-led intervention, or maybe it's an innovation that is really meaningfully engaging young people, and we can say this is working. It can be something that you were also greatly involved in or something that you heard of. So I will start with Tung, then I'll move on to Irene, then lastly, Thandi.
Thank you, Tinashe. I have shared with you about the community scorecard. I think it is really great models that we can apply, empower community and build relationship with the health facilities. In Vietnam, we also implement the other models that also can be considered to apply about the key populations friendly services. So we do the pre-assessment to identify the gaps and the issues of the health facilities, and together with them to build the change plans, and the community working with health provider to fill the gaps and to implement the change plans, including like sensitization training for healthcare providers, redecoration to make the health facility to be more friendly with the community, to link community-based organization with health facility together and listen to each other, and also provide the training for healthcare provider to, promote their services on online and reach more hidden population on online. And after 6 or 9 months, we come back and do the post-assessment to record the change and record the improvement of the health facility. Another models, I think, it is a community advisory board in each health facility. So that model, we're trying to collect monthly or quarterly the feedback from the community, from the clients, and together with the health facility to discuss about what is the real issues and how they can improve that, how they can change that. And I think in the end of the point, it is the engaged community in all levels of service delivery, monitoring and evaluations, and also provide feedback to the health facility. And we also should mention about the community-led service. It is very important because sometimes in some government and public services, they cannot provide all services. So community-led services is really important as the prolonged arms with the public health services. So we need to combine and put them together to work to better serve for the young key population. Thank you very much.
Thank you so much, Tung. So Irene, I will only give you 30 seconds and also
yeah.
lots of time.
Maybe I'm only have a short motto. Young people who are empowered and fulfill their rights. That's it.
Great. Thank you so much for those words, Irene. Thandi, any model that is working very well, directly engaging young people?
All right, so there is Youth Voices. That's an important component of youth involvement in creating opportunities for youth to express themselves, voice their ideas, and provide input for projects or programs, it is critical for youth to be heard. And also youth advocacy, offering ways for youth to speak out on issues affecting the adolescents and young people's health. And also young people being consulted about their ideas and opinions, and also researching issues that affect them. And also young people taking part in adult-defined decision-making bodies.
Thank you so much, Tung, Thandi, Irene. I am sending you my virtual hug. Thank you so much for being a great panel, Rumbi. It's now back to you. Back to you, Rumbi. You are on mute.
Hi everyone, I'm sorry about that. Thank you very much everyone for the great session. I'm also sending you virtual hugs and kisses. This was quite a very interesting session. And Melu, thank you very much for the great work you're doing in the chat box. I can see you're trying as much as possible to respond to all those questions that young people are bringing in. And I understand that this is one of the most exciting sessions that most young people were looking forward to. And I hope that we have been able to come up with the answers to most of the questions that we have had. So I think wrapping it all up, I want to say that is young key populations, the main eye, and ensure that we are able to understand what it is that we need and come up with very useful strategies on how best to engage ourselves and the service providers that we have around us. And also one other key important issue that we have picked from this session is that we need to maximize technology. COVID has changed a lot of things in the past years, and it's high time that we just adapt to the new trend, which is making use of the available technologies that are there. And then we'd also want us to be in a place to look at the already existing services and say to ourselves, what is it that we can do as young key populations to better the services that we are receiving from them? And then I've also have an understanding that as young key populations, sometimes we shun away from the services because we still have the belief that we are going to be stigmatized, a lot of negativity is going to come our way. But then I understand that efforts are being made to ensure that as young key populations, we have and receive the services that we need. So we need to go and receive those services positively. And I think that being said, I would want to thank everyone for attending this conference, and let's keep engaging. The future is us. Thank you very much, everyone.